We will start with the basic assumption. We believe every student participating in simulation activities at Troy University is intelligent, capable, wants to provide the best care, and desires to improve professionally. Some housekeeping. First of all, welcome again to Simulation Today. We are excited to give you the most interactive and life experience that we can. You've signed the confidentiality agreement and understand that information from our simulation today will be used for educational purposes only. To help make everyone's simulation experience memorable, we ask that you do not share what you have done today with your peers so that they can have the same learning experience that you had. Simply put, what happens in sim stays in sim. Although our sim man is not a live patient, we ask that you treat him as such. Our sim man will blink, talk, respond to your actions, have vitals, and change based on your nursing interventions. You may encounter a family member or friend of the patient in the scenario, or even ancillary staff. These are embedded participants that are here to help you and not to trick you. You may use this person as a resource. They can help with assessment findings or help answer questions. They can also help with technical difficulties. Perform all activities on your patient as you would in the clinical setting. Place your stethoscope on the patient to hear a heartbeat. Check for pulses, apply oxygen, and administer medicines ordered. Utilize resources in the simulation room to help take care of your patient, such as the chart, the phone, the Omnicell, or even the computer. When simulation is complete, faculty will instruct you on where to go for debriefing. Simulation is a safe place to learn, so if at any time you feel uncomfortable, please let faculty know. We all come from different backgrounds with different life experiences and view situations differently. If you need help, feel ill, or need to leave, please use the phrase, "This is not a simulation," and a faculty member will help you immediately. Our sim man is an integral part of our nursing program, and we need to keep him healthy. Before you leave the simulation room, check your pockets to make sure that you have no supplies that belong in the sim room and that none of your supplies remained in the sim room if they belong to you. For today's Skills Fair simulation, we have 6 objectives. We want to increase the confidence of students when they are performing focused assessments. We want the student to gain knowledge of non-coring needle insertion. Goodness gracious. We want the student to gain knowledge of preparing and programming IV pumps. We want to review the insertion of urinary catheter procedures. We want to review the tracheostomy care procedures, and we want to review proper PPE procedures. So what will we be doing? Well, we are going to proceed through several skills. When you arrive at your designated time, you can report to one of 4 stations. If you go to one that's full, the instructor will tell you to go on to the next. You'll have a card that you will get stamped at each location to kind of show that you completed it, and there will be a spot in Canvas for you to upload those. And let's go into a little more detail of exactly what you'll be doing and where you'll be going. The students will arrive at their scheduled time and report to one of 4 stations. The Focused Assessment Station, which is going to be located in the back lab near Dr. Law's office. The PPE Non-Coring Needle Station, which is going to be located in the back area of the main lab, that area that's kind of in the back, that's got the doors that close. The Preparing and Programming IV Pump Station, that's going to be located in the main lab towards the back where the supplies are kept. And then lastly, the Foley Catheter or Tracheostomy Care Station. That's going to be also located in the main lab, and it's going to be that area right when you walk in. some information about documenting and debriefing. When you have completed all 4 of your skills, you'll need to report to the debriefing area, and that's going to be designated the morning of, and so we will tell you where to go. After debriefing, you're going to need to document your findings of your focused assessment. So you may either be documenting on paper and have to upload it into Canvas, or you may be documenting directly into Canvas. Remember that this is an environment for learning. You can utilize your resources. So feel free to bring your nursing cheat sheet or bring the one that's going to be located in this module so that you can take notes during your focused head-to-toe assessment. And you can also bring the skill sheets that are in this module, or we will have some at each of the stations. Nursing is not about knowing everything, but knowing your resources so that you can properly take care of your patients. When you get to the floor, there's normally a book of procedures or somewhere online that has procedures or policies that can kind of give you a step-by-step of what you're going to do, especially if it's a skill you've not performed recently. And you also want to make sure to watch the videos that are in this module to prepare. They're going to go over the pumps that we will be using, give you some examples of, rather a demonstration of how to insert a non-coring needle, and kind of be a review for you, so you'll be prepared for Tuesday.